Hi, my name is Dr. Jason Walters from Forest Park Medical Center. I'm an orthopedic surgeon, and I'm here to talk to you today about patellar tendinitis. So the patellar tendon is a very interesting tendon. It connects your tibia to your patella. It's actually misnamed. Tendons connect muscles to bones, but this actually connects a bone to a bone, and that would normally be called a tendon, and this is called a ligament. It's part of your extensor mechanism. It's part of the mechanism that allows you to flex and extend your knee. So patellar tendinitis is commonly called jumper's knee. It's an inflammatory process that begins at your patella tendon. Typically, patients will complain of knee pain and swelling with jumping and running activities. Initially, it'll probably just hurt at the end of the activities, and then it'll go on to hurt during activities and may progress enough even to a frank tear. Typical treatment for patellar tendinitis, the initial treatment consists of what we call RICE therapy, which is rest, avoiding the offending activity, be it running and jumping, ice, compression, and elevation. Typically involved in that would also be some anti-inflammatory medications, all aimed at reducing the swelling. So one of the common forms of treatment is a compression device or patellar knee sleeve or patella band. And the thought behind that is to compress the patella tendon, and that has been shown to decrease pain. Surgical options for patellar tendinitis, generally speaking, are rare. They can be indicated if a patient has failed all non-operative measures. The surgical treatment for patellar tendinitis would consist of a simple debridement, where the surgeon would make a simple incision on the front part of the knee, go into the area of inflammation and remove it, and simply reattach the tendon. That's a major undertaking. It's typically only reserved for the most severe cases. In summary, patellar tendinitis is an inflammatory condition about the tendon. Some simple at-home regimens would be rest, ice, compression with a patella sleeve or a patella compression band, and elevation. Also some over-the-counter anti-inflammatory medicines as well. If the problem persists, it would be best to get in to see an orthopedic surgeon, specifically one who treats injuries about the knee.